Hello, it's Dr. Jeffrey Spiegel from the Spiegel Center in Newton, Massachusetts, just outside of Boston. You can learn more about us at www.drspiegel.com. I'm happy to speak to you about advanced techniques in feminization of the face and voice. I've been doing facial feminization for more than 20 years at this point, and many of the techniques that we have been using were either devised here or have been refined to achieve the results that we desire. Of course, the goal of facial feminization surgery is to take a face such as you see on the left, which is unquestionably masculine, and make it unquestionably feminine. Ideally, the face will look youthful and attractive. This is important both because youthful and attractive go along with feminine, and because for many patients seeking facial feminization surgery, there is a great sense of a need to catch up on lost time. I've been doing facial feminization surgery for more than 20 years at this point, and many of the techniques I used were ones that I either had to devise because nothing was available, or I've refined over the years to achieve our goals. And the goals, of course, are to have a face which is both instantly recognizable as feminine, as well as seen as both attractive and youthful. Obviously, looking attractive and youthful are desirable goals, along with looking feminine. However, additionally, they can afford the patient who seeks facial feminization surgery the opportunity to catch up on lost time, something that's very important, especially when they go forward with transition later in life. This is a good example of what we hope to achieve. The face on the left is particularly and specifically masculine looking. You can see, even when smiling, that the cheeks appear flatter, the jaw is quite strong, the chin is wide, there's a prominent Adam's apple, there's a forehead ridge, the nose has a larger size and more contours, whereas the face on the right is youthful and attractive with a nice feminine hairline and eyebrows, fuller cheeks, a smaller nose, attractive mouth, attractive chin and jaw, and a lack of an Adam's apple. Even if you're not seeing transgender women for facial feminization surgery, you are doing facial feminization surgery because any woman who comes to you for facial aesthetic surgery needs facial feminization surgery. People get more masculine as they get older, and feminizing the face beautifies the face in very powerful ways. It's been shown for a very long time that this is consistent across ethnicities, across cultures. In all cases, making a face look more desirable involves making it look feminine, youthful, and attractive. Now, it's been well known that the more feminine a face is, the more attractive it's going to be seen, and this goes across all nationalities, all cultures, all ethnicities. There is a whole body of literature on this, which is extremely interesting to read and which will prove my point should you get to it. Now, most of the time when we learn attractiveness, it has to do with mathematical formulas. As you can see here, here's a face where we're trying to determine the correct nasal angle off the facial plane. However, is this face attractive? Is this face masculine or feminine? Is this a man or a woman? The longer you stare at these images, the less clear those questions are as far as their answers, and the more evident it is that femininity is a more practical and logical approach to attractiveness than are mathematics. More about that in another talk. Femininity passes, unfortunately for women. Femininity and such attractiveness as goes along with it tend to fade away, typically around the time that a woman loses her fertility. Thus, femininity and attractiveness are both logical ways in which nature allow us to identify a good mate. When trying to determine what's masculine and what's feminine, you should look at the fact that men and women have opposite facial features. A man's face has a large jaw, bulbous nose with a lot of detail in it, small eyes, low eyebrows, high square hairline. A woman's face is the opposite, with a relatively small forehead. This artist has drawn bangs which show that the forehead is being de-emphasized. The eyes, however, are extremely emphasized. Look at the difference between male and female eyes. The female eyes are extremely large and extremely bright. The nose is an afterthought, and the mouth is very bright with the jaw very small and the neck de-emphasized. We instinctively know to do this. When women take selfies, they hold the camera up in front of them and up and to the side so that they are, by nature, have to tilt their chin down, enlarge the eyes, and emphasize the positive and de-emphasize the negative. Similarly, men do the opposite, of course, where they hold the camera low to emphasize their chin and jaw, emphasize the strength of the face, and the eyes close and become less bright, all the features that are not feminine. This is a before and after of one of my patients, and you can see that this person instinctively took their photos with the head posed for maximum attractiveness based on the gender that they are portraying. So what can we do? We need to alter the light and shadow of the face. I need to make the face look attractive and youthful, and you need to make sure the skin is nice. Here's another example of how this works when it's done well. And another one, you can see a great increase in femininity and attractiveness of the face. In all cases, the person is going to look and project as naturally feminine, and yet what's been done is not evident. Now here's two faces that are exactly the opposite. I understand that the face on the left is smiling, a little bit of unfair comparison, but it's what was available to me in the photos that I had. Now, you can see a circular splash mark from the flash on the face on the left. This conveys a flat forehead. On the right, you can see a horizontal splash mark from the flash. This is where the light is hitting a ridge. That is, according to our research, the most significant area for facial gender determination, and one of the first places we look at to determine if a face is male or female and if a face is attractive. The nose on the left is more boring. It has fewer elements of character. The nose on the right has somewhat of an inverted V, a bulbous tip, full ala, and other features which are memorable. The cheeks are flatter on the right, the temples are more hollow, the jaw is more wide, the chin is more wide, there's an Adam's apple, and the lips are longer. These two faces are much more similar. As you can see, the nose is de-emphasized, the forehead is flatter and more natural, the hairline is similar, the eyebrows are arched, the cheeks are still somewhat flattened, but that's because this particular individual did not want me to augment her cheeks. The lip is shorter, the jaw is tapered, and the Adam's apple is gone. And here's a look at the face before and after. So good facial feminization surgery changes an enormous number of features of the face for the best possible outcome and the most natural results. Of course, the most well-known and significant of the things we do is a cranioplasty. The forehead needs to be contoured throughout the entire upper third of the face. The glabellar ridge is brought back, the orbits are enlarged, the prefrontal eminences are modified when necessary. The cheeks tend to be filled in, but we'll talk about that afterwards. There are many differences between male and female skulls. However, not all of them require modification. As a perfect example, the mastoid bones are larger on a male than a female head, but of course no one looks at the mastoid bone for gender determination on a day-to-day basis. There are a number of incision decisions and other decisions that must be made when doing a forehead cranioplasty. You must decide whether to go in front of the hairline or in a coronal position. This is based on the density of the hair, the position of the hair, and the shape of the hairline. This can also be done endoscopically at times, through a blepharoplasty incision, and in other ways. Is imaging necessary? Is another decision point. In the vast majority of cases, the answer is no. Imaging is, in my opinion, something that is not used by the experienced surgeon, not because they are too proud of their own skills, but because any surgeon who's done this a number of times will know that the information provided by the imaging does not help guide you in the surgery. It might answer some questions that you would have answered on the day, but it gives you no new information that you would otherwise determine, and is, in my opinion, both unnecessary for the patient in terms of exposure to radiation, however minimal, unnecessary for time, and a waste of resources. Whether to do a shave or a reconstruction, shaving refers to removing the exterior bone without resetting the bone. That, in my experience, and according to papers we published, can be done less than 5% of the time and is not something that is the best technique. This is an example of somebody before and after at 6 days. You can see how the forehead has been contoured smoothly into the nose, and all of those masculine elements are gone. Long-term results are good. Again, the natural attractive line for the forehead passes right through the airspace of the frontal sinus in the vast majority of cases, and it is not adequate to plan to shave or thin the bone in this area. Some surgeons will use what we call a technique of thinning the bone and then hammering it back, something of an eggshell technique, and I consider this to be a very poor decision for the patient's safety. The scar heals well in the vast majority of cases, although there is an approximately 2% incidence of the scar being too wide and needing some modification, such as hair grafts. If you are squeamish, this is the time to look away, but the forehead is done through a coronal incision. We go deep to the deep temporalis fascia. The supraorbital nerves are identified. The bone to be modified is identified. We begin from lateral to medial, working towards the center of the glabella, removing bone and catching it. The frontal bone is removed, leaving a wide open frontal sinus. Then there's a skull base drill out to allow for a reset and to prevent any sort of sinus complications or other things. You must be prepared to encounter any number of frontal sinus pathologies, including inflammations, mucosal infections, osteomas, and more. The bone is then set back, packed with bone cement, and secured in position. The hairline is critical. Square hairlines need to be rounded, and there are a number of flap techniques used for this. Modifying the lip is another important thing in facial feminization surgery. Women have fuller lips, but you can see the lips in the corner of this slide, while attractive, look somewhat off, and that's because they're dark. You cannot see the teeth. There's a number of decision points that go into this surgery as well, and that would include where the incisions will go, whether to do 1 or 2, the extent of incision, whether or not to do undermining, and whether or not one needs a corner lift. But the goal ultimately is to achieve brightness around the mouth. You can see in each of these faces that they are not smiling, but there's a great amount of light reflecting off the teeth. So in this picture where you can see the lips are full, red, and moist, which are the things that a lipstick company tells you are important, they're also bright because we can see the teeth, and that's critical. For Adam's apple resection, to reduce the Adam's apple, there is really only one method that I think is safe to do, and that is to use a video camera to determine the position of the vocal cords and the anterior commissure. CT scan imaging is not adequate, in my opinion, and would not be a safe way to go for somebody who's experienced in laryngeal surgery. As you can see in this photo, this is an endoscopic view, and in the photo on the right, you can see a needle coming through the front, which identifies that the plane of resection is going to be superior to the anterior commissure. Results are immediate with a safe voice. Number of decisions include the technique for removing this, and you must be prepared to repair the larynx in case the larynx fractures, because there could be problems with the voice where the voice would lower from something like that if it was not addressed immediately. Voice surgery can be done as well. With voice surgery, we do an anterior web creation. As you can see, the anterior web has been created by lasering away the mucosa and then securing it in position with sutures. Cheek augmentation is important for filling in the anterior aspect of the cheeks. It's not just lateral, but anteriorly, so that the lower lid cheek junction blends smoothly. I personally do not like these textured implants and prefer the smooth silicone implants. I believe that the textured implants, which can form allegedly, create dead space and increase the infection rate. Cheek augmentation is a very significant way to feminize the face. The type of material should be carefully decided upon. As mentioned, I prefer the silicone type because they have limited dead space and thus reduce the risk of infection, plus they feel very natural. Jaw surgery is important, for male jaws are much wider than female jaws. The jaw can be modified with Botox if it's largely the masseter muscle, but in most cases we need to modify the bone specifically. Swelling is pronounced for at least 3 months afterwards, but significant contouring can be done. What's most important is to determine the amount of bone that is going to be removed, because if you remove too much, you're going to have softness of the chin and looseness around the mouth. I do this through 3 intraoral incisions. Thus preserving the mental nerves where they exit the bone with a cuff of mucosa and muscle and tissue for their safety. In doing this for 20 years now, we have a 0% incidence of permanent numbness around the mouth, although temporary numbness is of course expected. One must decide whether to do a genioplasty or remove bone on the outside. I prefer to remove bone along the outside edges rather than do a genioplasty because my method avoids the use of any intraoral hardware. And over the last 20+ years, I've seen a number of cases where people have had to come back after implantation of screws in the chin to have these things removed or because of pain and discomfort. Significant modification can be achieved, but again, the swelling persists for a long period of time. Here's some examples of chin modification and what can be achieved. Especially with a witch's chin, one must be careful about how much soft tissue is removed, lest the chin soft tissue fall and paradoxically look wider and less feminine. Rhinoplasty is well covered, but feminizing rhinoplasty involves significant reduction in the size of the nose. There are a number of methods for reducing the nose volume. In some cases, even removal of some of the skin of the nose is necessary. Simple things like taking down the dorsum can substantially feminize the face overall, and techniques such as reducing bulbosity of the tip will also feminize the nose substantially. Before embarking on facial feminization surgery, please be certain that you are prepared for this. This is a very high-stakes procedure for the people who are having it, and you will be under intense scrutiny for your results and techniques. However, a great amount of satisfaction is available to the patient, and one can significantly improve the quality of life of those receiving facial feminization surgery. Here are a few more photos as an example of what can be achieved. Any procedures which create anti-aging are going to be feminizing, but those will be less feminizing than the ones which affect structure. Thank you for your attention.